Hey guys, welcome back to my channel. My name is Jen. This is going to be part 2 of 4 of the Migraine Aura series. Sorry, buddy is drinking water. I should wait. Anyway, I'm Jen. Welcome back to my channel. I can't do this with you. You're so cute. Look at the happy. Just so happy. I love pets. There are 4 different types of migraine auras, so I'm making one video on each of the 4 types. Part 1, the visual aura, went up earlier this week. Today's going to be sensory, and then the next 2 will be language and motor. If you missed part 1, I will throw a card up for you, and if you are looking forward to parts 3 and 4, make sure that you hit subscribe. Subscribe? Where's the subscribe button? If you came here from part 1 and you are binge watching, I love you. Hey, Bubba, am I having a migraine? Can you check? Yes. Thank you. Good check. Well, given that a migraine's coming, we better hurry up with this. So follow me, as if you have a choice. Sorry. I mention this in basically every video where I talk about my symptoms, but please be careful when you're listening to any of my advice. Anything that I tell you is anecdotal. Just because it's a migraine aura for me doesn't mean that that's what it is for you, and a lot of these symptoms can be attributed to many different other conditions. So if these symptoms match up and you suspect it might be a migraine aura, great. I'm really glad that I could help you, maybe find some answers for yourself, but the next step is to go talk to your doctor and ask if that's the right diagnosis for you, because our symptoms matching up doesn't necessarily mean that it's the same diagnosis. Whew, pot's got me breathy. Huh, bud? So I guess, I know. I don't know what it is about today, but it feels like a good day for the party rock. Can I reach? Haha. Can I sit for a little bit, wait for the pots to calm down, and get to the sensory aura? All right, so a sensory aura is not the most common type of migraine aura, but it still is pretty common. And despite that, I feel like a lot of migraine patients don't realize that it is an aura that can pop up. A sensory aura is much easier to explain to non-migrainers because, unlike visual auras, the sensory aura sensations are ones that non-migrainers do feel. This video is a lot less daunting for that reason. With the visual aura, I tried to do digital renderings of some of my auras, but that was really hard to do when I'm not very tech savvy and I'm very new to making videos. Just like all of the other videos in this migraine aura series, anything that I tell you that's factual, my source is going to be Mayo Clinic, and anything that's my own experience, of course, is anecdotal, and I've already told you to go talk to your doctor. A sensory aura can happen at the same time as your visual aura, it can happen after, or it can happen over the total duration of your attack. And it's sort of a tingling, numb, pins and needles sort of feeling. The feeling will spread up and down your arms, it can go up into your face, and it can even enter your mouth. Usually it starts at the fingers or maybe even in your toes, and it'll spread up and down the arm for about 10 or 20 minutes. This migraine is coming on a little bit fast, and I'm having some trouble describing what I mean here. I'm already getting a little bit of the brain fog. I'm having a hard time... Crap. With the visual aura, I try to describe that as the visual aura goes away, it leaves in its wake a bit of a nothingness. That's kind of also what happens with the sensory aura. When your pins and needles stop happening, when the pain is over, it's numb. For some migrainers, the numbness is actually a very intense weakness that leaves them paralyzed. That does happen to me, and it is absolutely terrifying. Of course, once you recognize that it's an aura, it becomes less scary, but that doesn't really make it any less traumatizing when it does happen. You just know that you're not dying, or at least you presume that you're not dying. One of the first videos that I ever posted was the unexpected benefits of having a service dog, and one of the benefits I mentioned in that video was that I learned my migraines better. Before the aura comes the prodrome, and before I had my service dog, I wasn't getting visual auras, and the only prodrome symptom that I really had consistently was a little bit of irritability, which, let's be honest, can sort of happen anytime, and yawning. But prodromes and auras and attack face, all the symptoms, especially for an atypical migrainer, can vary from patient to patient, but they can also change from migraine to migraine within the same patient. So before, if I didn't get any irritability and I didn't get any yawning, and then all of a sudden I was paralyzed, it was really scary. Now I have the service dog, and he'll warn me even earlier than my aura that a migraine is coming, and I'm very thankful that I get that peace of mind, that this is just an aura. Not everybody is that lucky though. And I think it's really important that people who are non-migrainers, and frankly even people that are migrainers whose doctors haven't told them that this is a symptom that can happen, I forgot how the sentence started, but point is, for those people that I just mentioned that I already forgot, it's very important that patients are aware that this can happen to them, and it's very important that the general public knows that it doesn't matter if you're already in the attack phase of your migraine. The aura can be just as debilitating, if not more debilitating. I've had prodromes where I was paralyzed. I've had attack phases where it's silent and all I had was a little bit of mild nausea. It really is highly variable. I'm very sick of hearing it's just a headache, and I'm sorry that now I'm ranting, but like, this is not just a headache. I'm so passionate about this. I'm so passionate about sharing this message that I filmed myself having a complex migraine and I posted all of the embarrassing footage on the internet. Ah, boy. Oh my gosh, I'm having so much trouble with talking. Okay. Back when I was first diagnosed with chronic migraines, nobody warned me that the symptoms could get this scary. And I heavily relied on other people who were online being brave like this and sharing their own stories to tell me, oh my gosh, I'm having a sensory aura right now. Guys, do you see the goosebumps? Oh, is this meta? I don't remember what meta means. So meta. This is like aura inception. This is great. Oh, it's very uncomfortable though. Okay. So it started down here. It came up. Oh my goodness. Oh my goodness. Let's pause again. Okay, I pushed play because my arms are getting really heavy and I might become paralyzed soon. I'm going to call my husband and let him know that I'm not doing very well so that he's aware. My visual aura was probably pretty interesting because it's unusual from the typical aura that most people get, but my sensory aura is quite by the books. I don't usually feel it in my tongue, but I do get it all the way up my arms and into my face, and I get it on my legs as well. Depending on when the sensory aura happens in my migraine phases, sometimes it's just a little bit uncomfortable, but sometimes it can be quite painful. Sorry, I keep saying like sometimes and usually and might, and that's just the nature of migraines. Everyone is different. Now let me explain. Sometimes during my attack phase, I get really sensitive skin. I call it sunburn skin because that's exactly what it feels like. And if I've shaved my legs recently, ladies, you know what I'm talking about. And actually, I guess men would know too. You get the stubble that's really uncomfortable to move, it's really uncomfortable to rub if it's on a sensitive part of your body. I'm starting to get some language aura. Oh my God. That was a sneak peek for the next video. Language aura. Okay. But for me, sometimes when the stubble comes in on my legs, if it's a time when my skin is particularly sensitive, then wearing jeans and getting a sensory aura hurts like a madman. So I hope that makes sense. Sometimes it doesn't hurt, but sometimes just too many surrounding circumstances happen at the same time and pain can happen. I'm sorry that this video has been all over the place. I'm sure that you understand, and I hope that you found it insightful. I really don't like it when my video has a ton of interruptions, but I think that it's important that I leave them in because if all of my video is just me acting normally, then it doesn't get my whole point across, which is that migraine is a horrible neurological disease, and it's very highly misunderstood. Again, the whole point of this is to teach you and become aware, and I think it's important that people see that even though a lot of times I come off like this, sometimes I am like I was 30 seconds ago or however long ago, you know, having trouble speaking or having trouble moving my arms. So if you support this message, please give the video a thumbs up. The best way that you can ensure I can keep making videos like this is for you to subscribe to the channel. Show YouTube that this is content that's important to get out there. I would not have been able to make as much of a recovery as I have without other people before me being brave, stepping forward, sharing their raw footage as well. So thank you to everyone who has ever done this, and I'm excited that I'm in the position now where I can do the same for the next round. I'm excited to pay it forward. So I really hope to see you in the next video, and yes, if you didn't notice, I did already turn off the party rock. Yeah. And he's back and being weird.